Today I'm going to take you on a tour of the Social Sector Wellbeing and Resilience Hub, otherwise known as the Community Well. Now you see when you go to the home page, we've designed the site around 6 pillars of wellbeing and resilience. Each of these pillars includes a number of modules and a number of resources, approximately 100 in total, but designed to be very user-friendly and digested in bite-sized pieces. The first thing we recommend is that leaders take the organisational health check by starting here. They'll need to answer questions about their organisational practices and policies in wellbeing and resilience. And once they've answered those questions, they'll receive a customised and confidential report via email, providing information about their own organisational performance and directing them to priority resources to further save them time. The organisational health check report looks like this. There's a key which shows a summary of how the results are organised, and the leader can go through one by one and look at the pillars and the modules in those pillars and see how they're performing. As an example, on page 9, under Leadership Practices, which is under the Protect module, they can actually link straight into the module on leadership practices, or they can go into one of these 2 specific resources that have been put there specifically to help them get access to what they need as quickly as possible. Leaders and individuals are also welcome to use the site in an ad hoc fashion, going into each of the pillars, choosing a module. For example, in Protect, under Leadership Practices, there's a summary of what this means, what is leadership practices and what does it look like when it's done well and not well. And then we've provided 6 resources here, some of which we've developed ourselves and some of which are external resources, which we think are perfect to fulfill the module of developing really strong leadership practices. So there are 6 pillars and 11 modules. We recommend that leaders start with Prevent and Protect. However, they're welcome to start wherever they need, and sometimes this might be starting in crisis or in recovery. In addition to the 6 pillars and the resources, there is also a menu item called Advocacy, which is where we're looking a little bit more up from a helicopter at some of the structural causes of what we call the wellbeing deficit. And we're inviting the social sector to help us fly the flag for better practice. Now, there are 3 modules under Advocacy and Action. For example, Improve Wellbeing Practice. One of the signature assets in the Improve Wellbeing Practice module is the Wellbeing Lens, a brand new asset which enables organisations of all types, be it grant makers, intermediaries, peak bodies, government, not-for-profits, social enterprises, impact investment organisations, to take a helicopter view of their organisation and look at where they might be able to improve wellbeing practice more holistically across their organisation. In addition, there are resources about building resilience and working well with volunteers and conducting grant making with a wellbeing lens. The other 2 parts of advocacy are connecting and spreading the word via a number of comms resources, events, awards, etc., and acknowledging great practice where it exists. So I hope that's a helpful start to navigating the community well, and please contact us if you have any questions or comments. We'd love to hear from you. Thanks.